So what I was going to mention actually as one of the future innovations, and it fits closely to this, is I am going to talk a little bit about technology because I think it is a major game changer in healthcare. And when I talk about the technology, it's how it's going to be used within those settings. So what we're looking at right now is there's a phenomenon going out there called health information exchanges. And there's a lot of health information technology stimulus dollars that are available to create those networks. And what we're doing is we are aggregating the information from our electronic records from different platforms, and the hospital information, and the laboratory information, and the radiology information, so that when you walk in to see a physician, I'm going to have all that information at my fingertip. When I send you to a cardiologist, that cardiologist is going to open the same record, have the same information, the same problem list, the same medication list. That is going to revolutionize healthcare. It's going to bring down the cost, it's going to prevent the redundancy, you're going to be more satisfied in what happens. Future state, we will have Bluetooth technology where you'll be able to monitor your blood sugars from home, those be electronically transmitted in, and the care team will be able to look at that information. For those of you that like Twitter and other types of social media, you'll be contacted by your physician's office instead of a phone call to say, hey, you need to be scheduled for follow-up on your medications. And so you'll be able to tell the office and your care team exactly what you want to happen. So I think we're going to get more into technology,
Absolutely.
but I think it's a very big piece and some of the game-changing that we're going to see.
Thank you, John.
Yeah.
Jim?
Well, someone I don't think you're going to have some rebuttal the way you do in a presidential debate.
No, no.
I agree with everything that both Tom and John have stated here, and I agree completely, especially with regard to the technology, medical technology, and the things that are occurring in that part of the equation. I agree on the primary care side of the equation also. I'd like to see a greater focus, however, on preventive care, and I think as part of some of the initiatives that are out there in the marketplace currently, you tend to see some of the larger multinational corporations who have adopted these types of programs, and the significance of them really can't be understated, because at the end of the day, they really are saving hundreds of millions of dollars within the healthcare system. So I think there's a combination of both on the preventive side of the equation, in combination with primary care, and certainly the technology. The technology, as John was just stating, we've been blown away by the current technology that's out there and the ongoing development in a variety of areas. It's not only the information sharing, but it's the ability, again, on a preventive basis or a primary care basis, of actually diagnosing a patient remotely. In the past, the history of this has been you would have a store-and-forward type of technology where, for instance, somebody would be in Montana and they would diagnose through a call center that was in Australia, for instance, on a broken limb of some variety. So all of that is dramatically changing practically on a daily basis. So I think that's a big part of it. The other thing I think it's absolutely critical that we in the United States focus on, and that is really streamlining our existing system, because there are billions and billions of dollars of waste in our Medicare system and in most of our systems. And I think that the proposed legislation, and I won't get into that political debate, but I think at the end of the day, it's inherent upon us to look at this. And I'm certainly not going to finger point at insurance companies or anybody else with this matter, but I think we really need to do something. And I think that at the end of the day, it's going to be critical that we do that.
Thank you. Jonathan?
Thanks. Jim alluded to the healthcare debate.